Yesterday, we finished talking about our internal and external bones of the skull. We started talking about the rest of the axial skeleton, our spinal cord. Somebody remind me how many cervical vertebrae dogs and cats have?
7.
And C1 is referred to as
Axis.
C2. Very nice. How many thoracic? 13. And the thoracic vertebra articulate with what?
Ribs.
Very nice medical term for ribs. Yeah, hooked on phonics worked for you. Right up there. How many pairs of ribs?
13.
13, because every thoracic vertebra has a pair of ribs attached. How many lumbar? 7. Sacral. But what do we know about it? They're fused. What part of the pelvis does the sacrum articulate with? The ilium. The ilium is your sassy bone. Then you have your tailbone, which is referred to as coccygeal or coccygeal. Very nice. So now we move on to the ribs. And again, you can kind of turn your thinking caps down right now because you've already covered all of this. There is no shocking new revelations today. The ribs are flat bones. The medical term for rib is costo. Sternal ribs attached to the sternum. And if you have a rib that is directly attached to the sternum, it is referred to as true. And if you have a rib that is not directly attached to the sternum, false. And if you have one that is only articulating with your thoracic vertebra, floating. Look at that. This is going to be super, super duper easy. Picture. Here we've got our true ribs. I'll get on here so everyone can see me.
So are asternal and false ribs the same thing?
Yes, they are. Because asternal would be without sternum. So here I've got my sternal or true ribs attaching directly. Here's my sternum right here. You can see I've got a rib here. The end is floating off into space and we have that cartilage bridge. That would be our asternal. And here we've got a little floater. On the ventral aspect, my ribs articulate with the sternum. Now the sternum is not a solid bone. It is created and structured very similar to our vertebral column. The vertebral column is made up of individual bones called vertebrae. Our sternum is made up of individual bones called sternebrae. We have a little notch right here. You can feel it. This is called your manubrium. That's your manubrium. Down at the other end, you have a little tail called the xiphoid process. Now, the manubrium, the reason why you have that little notch is to give room for your hyoid and other tracheal structures. Your xiphoid process has a humongous bundle of nerves that runs just around it. And that bundle of nerves can, in fact, help to stimulate your heart rate. It can also help us when we are doing surgical procedures. Anyone in here, you've ever had surgery? I'm assuming everybody in here has had surgery at some point in your life. You have never had surgery? You've never been put under anesthesia? You did what?
I want erasers put on my ear.
You put an eraser in your ear? I was about to say, I hope this wasn't like great. Although, have you watched a medical show on TV? Any medical show? Well, you know when they're trying to wake up a patient and they
Do the
take
hard sternum rub.
and they do it's called a sternal rub, and they'll take their fist and they'll rub it. It's because you have this massive webbing of nerves that go right down the sternum, and it's a pain response. Holy smokes, we do use this in veterinary medicine. If you have an animal who's taking a little bit longer to wake up, we'll go ahead and do that sternal rub. You don't do it on yourself. It's one of the very few places you can, in fact, hurt yourself. Yeah. That bundle of nerves ends here at the xiphoid process. And very often, if you have an animal who has got an irregular heartbeat, or a person, I actually do have an irregular heartbeat. My heart skips beats. Does yours as well? Not all the time, but more frequent than not. And it's not a big deal, but if it skips 2 or 3 in a row, oh. Then you
Mine does too, Miss Huff. They called it bigemity or something.
That I don't know. Mine is an electrical impulse issue. But what you can do is you can push on that xiphoid, not hard, because again, you can hurt yourself. But if you push on that xiphoid, it'll cause the electrical conduction to even out. It's like giving yourself a little like defibrillation. Clear. Instead of that, you can just push on it.
I got friends now that was a kid.
Yeah, I broke my xiphoid.
Yeah.
I fractured my xiphoid. That they think that might in fact be the cause of the electrical issue in my heart, because it didn't heal properly, so it's like off to the side. I fell. I'm a very clumsy person, as you are now learning, and if something bizarro or weird is going to happen, it's going to happen to me. So I'm so stupid. Now, I had just moved into my house that I live in now, so this is longer than some of you have been alive. I'm going to curl up in the fetal position now and assume my position. So I just moved in. I know we've been there maybe 4 years or so. So it was relatively still new. Had just laid down brand new tile floor.
Excuse me.
Yeah.
Can you guys check, not you, Miss Huff, but other Zoomers? Can y'all check y'all mics, because some of them are on
Oh, I can go ahead
and I can't hear. Thank you.
There, everybody's muted. So yeah, I had brand new ceramic tile put into my house, and I was mopping it, and I didn't realize how slippery it was when it's wet. And I was coming around the corner from my sofa, and my feet went out from under me, and I hit the corner of the sofa. And it put me on the floor for about an hour. I couldn't, I just laid there on the floor. Shallow breaths. I couldn't breathe. My heart was going haywire. I thought I was gonna die. And my then husband came home and was like, "What's wrong with you?" And that's why we're not married anymore. But I did. I went to the hospital and I fractured my xiphoid process. Already said. So the sternum is your breastbone. As I said, the cranial is your manubrium. I'm going to minimize my TV audience. So, or actually, I'll just move you over here. There we go. The cranial is your manubrium. The caudal is your xiphoid. And we got to be really careful, especially in humans, because you can fracture the sternum and the ribs if you're performing CPR. Animals, it's not quite as likely because we don't perform CPR the same way on animals. Instead of pushing sternally, like you get someone on their back and everyone has seen CPR. Animals will generally do it with them laying on their side. because a lot of animals have that big barrel chest, and it's easier to compress the heart laterally versus sternally. When my father had, my dad, he had heart surgery. It's what they cut through. They do a sternotomy, or the surgical incision into the sternum, and then split it there. Open it up. And so there's our sternum, there's the manubrium, and there's the xiphoid. Ooh, I was pushing on my xiphoid, now my heart's skipping beats. Whew. Ooh, my goodness. Now we move into the appendicular skeleton. And again, I don't think I'm going to have any major revelations for you today. Relatively easy workload. The appendicular is everything that comes off of our core. Essentially your arms and legs, which is why they are called appendages. So we're going to look into the thoracic. You already know all of this. I point, you say. Scapula, humerus, radius, ulna, carpus, metacarpus, phalanges. Your pelvis is part of your appendicular. You have 3 parts to your pelvis. The ilium, ischium, pubis. So the ilium is your sassy bone. The ischium, if you bring your legs up, that's your butt bone that you're sitting on. You ever have a little kid come jump on and sit on your knee and they stab you with their butt bone?
Yeah.
That's their ischium. And then your pubis is in the front. Femur, patella, tibia, fibula, tibia, fibula, tarsus, metatarsus, phalanges.
Don't forget.
What is happening, Sean? You have gone cuckoo.
The scene from Harry Potter where Hermione's talking to Ron. It's Leviosa.
Not Leviosa.
Oh, you are just funny.
Oh man. That's the first person I got to call that.
So here we've got a picture. We're going to go through each of these bones. But here we have, oh, I don't want the highlighter. What do I want? I want my laser pointer. Scapula. Here we have the scapulohumeral joint. See, we're using our medical terminology, you guys. What part of the humerus am I pointing to right here? The head. The head. It's fine. I'd rather you say it wrong now than be on the test. What are these rounded parts of the humerus at the distal end? Nice, our condyles. Here we have the ulna that makes up the point of the elbow. Does anyone know what this part of the ulna is called that makes up your elbow? You guys. Jeez. The olecranon. That was very creepy. This bone right here. The radius. The ulna forms a hinge. The radius is called that because it turns your lower limb on an axis at a radius.
Is that the one on your thumb? I always learned it like your thumb makes like a circle. So that's the one that's like closer to.
Yeah, because you have these bones go crisscross applesauce. You can actually kind of see it. So if I'm holding my arm like this, my radius starts here And you can see the natural muscle as it comes across like here. That's my radius. Because right now they're crisscross applesauce. My ulna is going this direction. My radius is going in this direction, but then they're now parallel. I know, it's kind of crazy. And then of course you have your carpus, metacarpus, phalanges. And we know that our dogs and cats walk on their toes and their fingers. They are digigrade. So the scapula, we're just going to go through each of these bones, just kind of do a real quick review. Our scapula is a flat bone. We've already talked about the processes that come off of it that form muscular attachments. We also had the depressions, which were called the fossa, which is where those nice round muscles go. We have here the spine of the scapula, which again is just muscular attachment. And then right here, I have an area where my humerus, which I do not have a humerus. Let me grab a humerus and I can show you the scapulohumeral joint.
And appendicitis, isn't that
Yeah, that's an equine and a whole other beast. So I just want it not in boba. So here I have a bovine humerus. The head fits right there. And this is called the glenoid cavity. The glenoid. All right, how many people in here had watched The Walking Dead back when it was still a good show? A few of you. Okay, those of you that have not, spoiler alert, because there was a character, a beloved character, who Negan bashed in with a baseball bat. What character am I referring to?
Glenn.
Didn't Glenn end up with a big dent in his head after that? That's how I kind of remember glenoid. I don't know why, but whenever I say the glenoid cavity, immediately, mentally, I see Glenn with his eye popping out. Glenoid, Glenn. For some of you, it might work. For others, not. That's okay. But this is the glenoid, and this forms the socket in the ball and socket joint. Yeah, I stopped watching it after there was a guy who had a tiger.
Oh, Ezekiel.
And they turned Carol into this pacifist and she didn't kill anything. And I was like, nope, puff out. Puff is out. All right, so here we have our humerus, which is the most proximal long bone. Remember, need to know your proximals and distals because that is how I'm going to test you. Here we have the head. Is the head of my humerus. We have the condyles at the distal end. And here, oh, I want, oh, you're fine. I can have radius end and ulna right here that are fused together. Radius and ulna are fused in the bovine, but we know that this is the olecranon. We have a hole right here, which is a fossa. Check this magic out. Bam. fits perfectly right in there. And that's why it's called the olecranon fossa, because it's where this piece is gonna fit in. So right now, we got something that looks like this. Pretty cool, right? All of these bones also have little door stops on them to help prevent us from moving them in a way that would damage soft tissue or muscle or even the bone itself. For example, here on the humerus, we have this little crown over the head. This is called a tubercle. We have the greater and the lesser. You don't need to know that, you just need to know tubercle. And basically what this does is it interacts. You see how there's a doorstop right there? Now, does that mean I can't lift my leg, my arm up over my head? Of course not. But this is a cow. If a cow was doing this, that's not that's not natural. Right? It's not like we have a ballet cow. We don't want to have a cow having a ballet moment. And so their tubercle is going to be far greater to prevent that motion that would tear and damage the soft tissue. They can move like this and walk. They can move this way slightly, but you can see that it helps to prevent that movement that would injure them. The ulna. The ulna is a bone that has the first letter of his name right in him. That little letter U right there. This ulna, as I showed you, fits into the distal part of the humerus. And right here, that's our doorstop. Every bone has a doorstop.
So like I know when you like pop out your shoulder, you can pop it back, but like when you dislocate your elbow, you have to like have X-rays to put it back. Is it the same in like animals?
Yeah, and the other problem is that, so this right here is called the acromion. Is it the acromion? The ankneal. I always get the acromion and the ankneal confused. The ankneal. This is little doorstop. And then our dogs specifically are small breeds, it'll break off. Yeah, it'll break right off. So when we engage, see, it fits perfectly right here in between these condyles. And then it engages and prevents us from going any further. Now I know one or two of you is going to be like, hey, Mutt, let's have, look at this. And you're like, your elbow does the opposite bend. That, yeah, it's really.
I wasn't sure if I could do it or not. I hope you did.
Can anybody do hyperextension? Yeah, you're doing it. Ew. Ew. I say ew. Oh my God, stand up. You have to stand up and show everyone what I'm referring to. Show and tell. Oh, geez. Do it this way. Oh God. Don't hurt yourself. Don't hurt yourself. Mine goes like this far. So what that means is,
You're a mutant.
oh Lord, yeah, you're turning into a spider person. Crab person. Yeah, you're turning into a crab person. So what we have is this. So you are, in fact, so this is extended, right? This bone is just like me doing this. But then look what is happening to you. And what's happening is this is coming and disengaging. So there's no really true such thing as double jointed. You don't have double joints.
You're just missing
It is hyperflexibility of the connective tissue.
missing parts. It's fine.
It's hyperflexibility. But that's what this is, the Anne Camille.
Would that be
The-
a saddle joint?
Be what?
Would that be a saddle joint? Or what kind?
This is a hinge. This would be a hinge joint, because if you think of your arm like a door, door open, door closed.
And if the Camille breaks off when they dislocate their legs, or we
It
try to put it
can.
back?
It can. The other problem is when you dislocate it, is the Anne Camille has to fit perfectly into this notch. And so if I dislocate it, it's going to take quite a bit of effort to put it back in and not break that process. That's why it's kind of a big deal.
Are you just born like that, the hyperextension and stuff, or is it like?
It's generally genetic. It also depends on your environment when you were in those growth and formative years. So like little children who were very engaged in things like gymnastics as they were growing and forming bones have hyperflexibility of that connective tissue. Not necessarily a good thing because you're going to pay for it when you get to be older.
So it's the same thing with people who use splits? Like,
Yes. Because the hyperflexibility of the ligaments that attach the femur and the pelvis, and I'm going to show you what's happening when you do the splits.
So when they like, well, what are they actually doing like when you're a kid when they pop your legs?
So you put a pin in that for just a second, because I'm about to get into the hind legs, and then I will have all my hind leg stuff up here to show you exactly what's going on. So that's our ulna. We have the olecranon process, the ankylosing, the trochlear notch, and then here we have the radius, which in our bovine is the primary weight. In dogs, cats, and us, it is not. It is not the primary weight bearing bone. They share the weight distribution equally. So there we have an ulna. Again, this is more of a canine ulna, and you can see just how fine and delicate these processes are, and they'll break right off.
What do you do when it gets broken off like that? Like you go in and
You send them to the specialist. No, I'm being serious. Because what often happens is that piece of bone no longer has blood supply. How well does tissue live without blood? It doesn't. So very often in the time it takes us to get them into the specialist, that fraction of bone has died. And what they may end up having to do is a bone, not transplant. Well, it's kind of like a bone transplant,
Bone marrow?
not bone marrow. What they're going to do is take a little sliver of bone from somewhere else and attach it into
Bone
the
graft?
elbow.
Bone graft.
A graft. Yes, thank you. Bone graft.
So you have to have it, like you can't just break it off and then just do it.
No, you have to have it. You need it. Because otherwise what's going to happen is you'll continuously traumatize all of that connective tissue, which in turn traumatizes your bicep and tricep. And eventually you're going to have to amputate the leg. The radius is the main weight-bearing bone. In our dogs and cats and people, it does share the weight-bearing properties with the ulna. Bovine, equine, it's pretty much the primary bone. And it's going to articulate distally rather with the carcass. I do not have a bovine carcass. Everybody okay so far? There's our carpal bones. Now the carpal bones are in fact 2 rows of small square bones, and they're called a gliding joint because these bones just kind of glide right over each other and give us motion. So our motion in our wrist, however, is really pretty limited. We do have motion like this, and I'm not talking because we're only going to motion this one joint. So I can do this, but this, I'm very limited. I can't even turn it. You can't turn it without turning your lower. We have the proximal row of bones have names, and these names are based on what do they articulate with. The distal row of bones has numbers, and they're numbered based on the digit that they articulate or the metacarpal that they articulate with.
So what we're feeling like right here, is that tendon? That we're feeling
So-
right here on the bottom part?
Are you talking like right here,
Right
your
here.
knob? Oh, so if you do bear claw, you can see it. So humans, when we get into the muscle part, which I find really fascinating, I've got a really cool video I'm going to show you. People, humans, animals, what have you, are put together just like puppets with puppet string. And so what you have is this muscle. So these muscles control this. These muscles control this. These muscles control this. And you can feel it. When we start talking about our phalanges, you can feel the muscle in your forearm moving as you're moving your fingers. So when we are looking at these muscles in the lower arm, we have tendons and ligaments. Tendons attach muscle to bone. Ligaments attach bone to bone. You can see mine right there. And what they do is we have very, very little muscle in our hands. Otherwise, we'd have these great big Mickey Mouse hands. But because we need to have dexterity, our fingers are manipulated by these strings that are controlled specifically by this muscle. That's what you're seeing.
Okay. I don't know if that was.
Miss Huff, is it like an articulation? Like
No. An articulation is 2 or more bones coming together. Ligaments and tendons
okay.
are connective tissue that attach bones together or attach muscles to bones.
Yes, ma'am. Yes.
So here we have our metacarpals, or beyond the carpus, meta meaning beyond carpus. So these are our metacarpals, and they coordinate with the distal row of carpal bones and our phalanges. How do we number?
Internal, lateral.
Medial to lateral. Air high five me. Medial. Because I know I had a student who was like, okay, medial to lateral. And I'm like, well, technically, you're right, this is now medial, but that's not the appropriate placement. It's always air high five. Medial to lateral. And the metacarpals are numbered the same way. This is metacarpal 1, 2, 3, 4, 5. Our equine, I don't know, did Ms. Rivera, I'm assuming because she's the horse person, went over a little bit of equine anatomy. So we know that our equine is fully weight bearing on a single metacarpal and metatarsal. So here we have the exact same anatomy, scapula, humerus. They have a very short humerus. Ulna, radius, carpus, metacarpus. Metacarpus, We have two little remnants back here of two other metacarpals that are not full. They're just support bones. And so our horse is walking on its third phalange, like this. I'm pointing it down. I'm not been able to flip this all off today. No, pointing it down. I'm pointing it down. But this is how horses walk. And then they have these two support bones, which are remnants of the metacarpal 2 and 4, which are just there to help support.
So it's 2 and 4, considering. So I guess my question is, so why is it 2 and 4 and not 1, 2, and 3?
Because
2, 3, 4 as opposed to 1, 2, 3.
when our horses evolved, horses used to have 5 toes. And as they got greater and greater, horses used to be the evolution, they were very small and had 5 toes, very similar to our dogs and cats. As they grew and evolved, the third digit is the most centrally located for weight-bearing support. And so they ended up, now I'm using my phalanges because I can't manipulate my metacarpals, but so they're most centralized here, and then these two ended up forming like this to support. These two now are not needed, so they just went away.
Yeah, but I understand that. But why is it, but instead of 1, 2, 3, it's 2, 3, 4? Is that
Because it's 2, 3, and 4.
Yeah. Because whenever you remove it, it doesn't, you don't change it over.
So one, my thumb is 1.
Well, no, I just didn't understand why it didn't change.
Because in order for 1 to be a supportive, if it was 1, 2, and 3, they'd be weight bearing on 2. Well, 2 is off to the side. It's a lateral digit. We want the digit that is most central to the leg and the weight distribution.
Does it change as far as counting for like with reptiles and amphibians, or we're still gonna do the same way? Like a lizard will still.
From what I understand in my incredibly limited knowledge of reptiles, is that every digit is counted the same way, medial to lateral. Because it doesn't matter if you are a bearded dragon or a chihuahua, your natural conformity is medial to lateral. You're walking like this. Now, obviously, things like a chameleon, those are going to have their own rules. So there's our hand showing the metacarpals. And here's a picture of our horse. And again, you can see that the third metacarpal is just the reason why evolution made it the weight-bearing bone is because it was the most centrally located. And then here we have the splint bones, splint meaning support, and those are the remnants of 2 and 4. And there's just a pig.
Yeah, weird thing.
They really do. And then, of course, your phalanges. Your phalanges are made up of phalanx, which is the singular term for the little bones that make up your fingers. Each finger, other than your thumb, is made up of 3. 1, 2, 3. And these are governed and controlled by your forearm. So let's play with our hands for a minute, because I find this really fascinating. If you hold your forearm like this and dramatically move your fingers, you can feel the muscle moving. In fact, I should really get that charged. I have the coolest thing ever. My significant other is a tech guy. Loves his toys. Loves his toys. And he bought me this thing called a Myo. What is myo the medical term for? Muscle. And it's a band that I can put on my forearm, and it connects to my computer, and it allows me to control my computer with hand motions. Like I can do this and advance the PowerPoint. I can go back. I can turn the volume up. I can turn the volume down. I can stop. I can play. I can do all of that just by moving my hand. It's really pretty cool. So we know that our fingers puppet string via tendons and ligaments to this muscle. But there is the thing we can do, an experiment that we can do to show the finite capacity of stretch. What do I mean by that? These ligaments, if you look, okay, so I have the ligaments attaching, but when I make a fist, those ligaments now have to stretch pretty dramatically, don't they? And then when I undo my fist, they go back to their original position. What we can do is in fact cause one of our ligaments to overstress. So what we're gonna do, I'm not gonna hurt you. Okay, trust me, I'm not gonna hurt you. What we're gonna do is you're gonna make bear claw. And I want you to feel your fingertips. Are they pretty secure? You can control them. Like if I push, you're not going anywhere, right? What we're gonna do now is we're gonna do our hand up like this. You're gonna take this finger and this finger only and bend it down like this. You have now overstretched this ligament package and you don't have control of your fingertip anymore. Dead finger. It will work with all of your fingers. It's just this one's the most dramatic. So yeah, you don't have control. But if we don't overstretch it, suddenly now, look at that, I've got control again. So that just shows what happens when you overstretch that ligament and you're now interrupting the muscle's ability to control it. I know, now you're all going to be sitting there playing with your fingers. That's pretty weird, right? Dogs and cats have the equivalent of our cuticles. If you look down at your fingernails, you know you have this fleshy little bit that encircles your fingernail. If you think about dogs and cats, you know that they have that same fleshy part that goes all the way around the nail, and that's called the ungual process. It's just the dog and cat. Anybody in here, although you guys are in intro, have you guys done feline toenails yet? Has anybody in here ever trimmed a cat's toenails? You know when you have to push on their toe and make it come out, and it comes out of that little fleshy, that's the ungual process. When you go home tonight, I want you to look at your dog's toes and that fleshy bit around the proximal end of the nail, the ungual. This is a picture. All right, let me get some pelvic limbs up here. Oh, I do already have my pelvis and my femur. Huzzah. My Mardi Gras mask. So those are all of the bones of the forelimb. Is everybody okay with the bones of the forelimb before we continue? Again, no real major shocking information. The bones of the hind limb include the pelvis, which are in fact 3 bones fused together. The ilium, the ischium, and the pubis. We have the femur, the tibia, fibula, the tarsus, the metatarsus, and the rear phalanges. Here we have our pelvis. Here's the equivalent of our sassy bone. These are the wings of the ilium. This is also where our sacrum is going to fuse, the sacroiliac joint. This is the butt bone that y'all are sitting on. You can give it a wiggle and feel it. And then here in the front, we have the pubis. Our pelvis does have a slightly movable joint, and you can, in fact, if I turn this pelvis around, you can see it. Somebody remind me what the medical term for this slightly movable joint is. Sin is going to be, okay, what's the one you're not saying?
Amphiarthrosis.
There you go. Good job. Amphiarthrosis. But the thing that I love is you did know all 3. Amphiarthrosis, slightly movable. And this is just mainly as a shock absorber. As our legs are going, we have a little bit of movement. And then of course in females, this is what allows the pelvis to stretch when I'm a baby. When a baby's being born.
So is that what you're damaging whenever you damage your hip flexor?
When you damage your what?
Hip flexor.
Now, you have got an awful lot of muscles and connective tissue that attach your femur to your pelvis. And so it's you damaged one of those. It's not a bony injury, that would be a connective tissue injury.
Okay.
Now, the ischium, the pubis, and then here we have, we have, just like in the scapula, we have the glenoid cavity. Here we have a nice little area for the femur to fit into, and this is called the acetabulum. The acetabulum. So here you can see that sacroiliac joint. And there's just another picture. This is, as I said, the acetabulum, which, get my femur facing the right way, this is the left femur. Watch this magic. Bam. Fits perfectly right in there and gives us a ball and socket free range of motion. We also have some holes in the pelvis. These are called foramen. Again, it's not shocking information. You went over all of these descriptive terms. Here we have my arms going through the foramen. These help to take down the weight of the pelvis, but they also allow ginormous nerves to pass through. Because the pelvis in the bovine is going to sit kind of like this, with their back up here. The spinal cord has all of the nerves that come off of it, and we've got to be able to get through the pelvis to the hind legs to allow the hind legs to have nerve supply. And so we have these holes that allow that to happen. So there we've got some radiographs. So here, get you oriented. The head is up here, obviously tail down here. This animal is in dorsal recumbency. Here we have the head of the femur. Here we have the acetabulum. Somebody tell me what you see in this radiograph. What is it? Yeah, good job, you guys. Hip dysplasia. Do you see how this guy's like, what's that meme, that SpongeBob meme? I'm gonna leave now. This guy's just leaving. He's just, this is what we want to see. We want to see nice coverage, tight coverage, the ball fitting right into that socket. Here, we don't even really.
Miss Huff, basically, it looks like the dog needs an alignment, pretty much.
No, the dog needs new hips.
Well, yeah, that, but you know.
Dog desperately needs either an FHO or a hip replacement surgery. This is not, chiropractic is really primarily for the spine. This is bony. This is arthritic.
Okay.
What we want to see is the socket covering at least 3/4 of the femur. Here we have our obturator foramen, and we're going to use these just as fun because our. Unmute yourself. You've got to be muting yourself afterwards, please, 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 please.
I know like we're not in nutrition like right now, we're gonna like go into it. I like was reading a book by this doctor from Washington, and he was saying that you can almost like prevent it entirely, even if like their parents had hip dysplasia with like a certain percentage of vitamin D. No.
No, you cannot nutritionally prevent a genetic predisposition. You can't do it. That would be like saying I have 2 parents with a genetic disease that they could potentially pass on to their child. But if I have the right nutrition, I'm not going to get that genetic disease. It doesn't work that way. Here we have our obturator foramen. And just as a little fun, you know, see the light at the end of the tunnel? Our Royals right now just started radiology. And these are what we're going to use as part of our toolbox to know if the patient was straight. Because, get my pelvis here, watch what happens. Okay, so do y'all see the obturator foramen? Okay. Now you see the obturator foramen. And so you see how they're pretty bilaterally symmetrical? And this pelvis is pretty straight on. Watch what happens to the foramen if my animal is twisted. So these are what I'm going to use to know that the animal was straight on in my radiograph. A little bit of radiology, pew pew, coming at you.
If you do have hip dysplasia and the animal isn't straight, I guess like if you don't have hip dysplasia and the animal's not straight, can it make it look like they have it or like vice versa?
Absolutely, and it can cause you to miss things. When you're doing pelvic radiographs, it is incredibly important to have the animal in as straight as you can get it, as bilaterally symmetrical as you can get it, and have the legs as straight as you can. Super important because otherwise you're not getting your landmarks. All right, so down from our pelvis, we have our femur. Longest bone in the body. At the proximal end, we have the head. Here we've also got doorstops. Now the big difference on our humerus, they were called what? Tubercles. On our femur, they're called trochanters or trochanters, depending on who taught you. My professor had called them trochanter. And you have your greater and lesser. And these are just doorstops. Again, when you're doing the splits, look what happens. See how it engages?
But it connects to anything else.
But what?
Does it like, put it back, put it back in one position? And then do the split?
See, and that's why when you're doing the splits, so now I'm doing the splits, but why can't I just keep going like this? Because look what happened to the head of my femur. It can go this far and no further. But can I put my legs up over my head? Sure can. Well,
So
some
whenever you can't
can.
do a split, what's stopping it?
When you're doing the splits,
Whenever you can't do a split, like somebody that can't go all the way down to the split, what's stopping it?
oh, that would be muscle. Because you are really, although anatomically you can do the splits, you are not meant to do this. This is not a natural position. In fact, it is such an unnatural position. We have a whole anatomical structure to prevent us from doing it. Yeah. So, no. No. But what you're going to see, especially when you get older, you could have arthritic changes that prevent the bones from moving smoothly. You can have muscular changes. You can have connective tissue changes. All of the above that cause a tightening of the joint and a loss of flexibility. Oh my goodness, I am like the poster child for loss of flexibility. Seriously, poster child. After I got the West Nile and got very, very, very ill, my body, as I told you, has now I have an immuno issue. My immunity group is attacking all my joints. When I was young, like your age young, oh my goodness gracious, I was the most flexible little thing on the planet. I mean, I would just hoist my leg right over that motorcycle because I used to be pretty big in the motorcycle community. Rode my own. What? Now, I couldn't get my leg over to get on that seat if devil had a gun to my head.
So when you have arthritis, what causes the bones to get stiff and stuck in that position?
So when you have arthritis, what is happening is an inflammation of the joint. Well, when you have inflammation, it causes swelling. Swelling of that connective tissue causes loss of flexibility. I have osteoarthritis, which means both my joints and my bones are inflamed. So that's what.
So like if a dog has like arthritis in his hips, when it inflames, it's just like the bones is getting stuck.
So you're getting caught up in the word arthritis. By definition, arthritis is anything that causes inflammation in a joint. The radiograph I just showed you of the hip dysplasia is a form of arthritis. Arthritis is nothing other than inflammation in a joint. It is not a condition. It is the clinical sign of something else. Does that make sense?
Yes, no, yes. Arthritis is not the actual.
It's not a condition, because we toss it around, oh, I have arthritis. Oh, I have arthritis. Well, that's great. Your joints are inflamed, but why are they inflamed? The word arthritis does not tell you anything. Are they inflamed because you have inflammation of the bursa? Did you have damage to the cartilage? Do you have damage and inflammation to the connective tissue? Is it an immuno issue? There's 1,043 things that can cause your joints to become inflamed. So here at the proximal end, we have our head, we have our trochanter. At the distal end, rounded, tells you what. Distal end rounded, tell me. Condyles, yes. And then here in the front, we've got a groove. Guess what fits right in there? Your patella. That's your patellar surface. The knee joint is the most complicated joint of your entire body. It is the only place in your body where you have four bones, four long bones specifically, coming together. Because we have the femur. What is it?
Oh, she was asking me a question. I was trying to. I don't know if I gave her the answer.
Okay, well, you could ask me.
Next to the, if the head that you said was the shape, you guys still call it the moral head too? Or no?
Oh, I didn't get part of that. What was that?
You said the head is the
The trochanters.
trochanthus. Is that also called the moral head? as
No.
well?
This is the head. These are the trochanters.
Yes, the head. What's the name of it? Is that
The head. The femoral head.
Okay, that's what I was.
So you have your femoral head and your humeral head. Femoral, humeral is just telling you what bone is it on, a femur or a humerus. Head is the structure itself. All right, so here is where our patella fits in. The patella is what we call a sesamoid bone. I think of it because it's a round bone, reminds me of a sesame seed. It's the largest sesamoid in the body. Why do we have a patella? Well, we have some of the largest muscles of our entire body. If you look down at your upper leg, some of your largest muscles, your quadriceps, that do this. Because just like in your upper arm, where this moves the structure below, here, your buttocks moves your upper leg moves your lower leg moves your foot. So we have a massive tendon that goes from here and then attaches here to your shin. You know, where your tibia, you can feel it, where your tibia raises up into the crest. So we have this huge tendon that goes over and then attaches here. And when this muscle contracts, it pulls on that like this.
Miss Huff, is that why like shin splints are so painful?
I don't have an answer for that because dogs and cats don't get those. And I've never
Really?
One of the few things I've never experienced, so I honestly have no idea.
Oh, okay.
Shin splints are what? So yeah, if you have a tendonitis, yeah, that's going to be incredibly painful. And oh, okay, yeah. So shin splints are just a tendonitis. So when you're pulling, that's what we're doing here. But if you look at it, so if you straighten out your leg, right? And if you look at the distance from above your patella to your shin, and now you bend your knee and keep bending and keep bending. Do you see how dramatically we had to stretch that connective tissue? Well, we need some sort of bridging over it to slide over so that when we go ahead and straighten this back up, because we now have a humongous gap right here. In fact, where's my... All right, this is not a tibia, but you'll get the idea. So when we have our tibia, we have our patella. What watch what happens to this joint when we bend the leg. Watch how much it opens. So I'm gonna bend it like this. So I am now bent like this. You see that's a giant cavern right there? What I don't want is now I have this big elastic that is stretched. When I straighten it up, I don't want it to go inside there and get pinched when we straighten our leg. And so that patella helps to form a bridge for it to glide over and prevents it from getting caught inside the joint. That's what patella does. Does that make sense to everybody? Man, I am getting my exercise today.
If it goes over your knee, like why is it so bone break? Is it just like that thin?
Yeah, so your ligaments are an incredibly tough connective tissue. But they don't have any bulk to them. They don't need bulk. They're attachment points only. They're meant to pull stuff. That's it. That's why the strings on a puppet are not this big around. They don't have to be. But they are super tough. And so that's why this is bony. Because we don't need to have any bulk. The bulk is up here. Unfortunately, more bulk now than there was, but yeah. All right, time flies when we are having fun, you guys. Holy smokes. All right, we are going to be finishing this up tomorrow. Here's what I'm going to do for you. Because remember, our skeletal test is not just skeletal test. What is it?
Midterm.
Midterm. We're going to finish up the skeletal tomorrow. I'm going to schedule in a wee bit of skeletal review. I'm going to schedule your midterm for Friday during class time. So it will open at the beginning of class at 10:05 and it will close at 11:30. We will meet for nutrition as scheduled. That way we'll build in a day for review. Make sure, I need you to go home tonight and everyone look over that all of the chapters, come prepared after we finish this to have any questions about any of the chapters we covered last term. Skeletal questions and your labeling will be due on Friday during class time. Risa, yeah. Does that sound fair?
More